I'm Linda Randolph, and I'm President and CEO of the Developing Family Center in Washington, D.C. I think that we want to provide to the country, actually, a model, a service delivery model that is innovative, that goes before prenatal care to actually pre-pregnancy through the child's third birthday. So we call it redefining the perinatal period. And in the process of developing this center, we had the opportunity to build upon two community-based organizations that were also in the community and had been there for a long time. We were able to bring these organizations together under a single roof with a common mission to reduce infant mortality, to provide a continuum of care from before pregnancy through the child's third birthday. And what this meant was bringing together an early childhood development center, a social services and support center, and a new birth center, out-of-hospital birth center that we developed and established, the first and only so far in the District of Columbia. This continuum of care seems to make sense to visitors who come to see us and see the integrated nature of the service delivery model and the innovations in practice that occur when you do a model such as this, so that each of the service providing partner organizations had to make changes, but they wanted to make changes that would allow for a better continuity of care for children and their families. One of the underpinnings of the center is empowerment. Empowerment of families to be able to provide the kinds of support to their children, and also to link those, what we sometimes call silos of education, health, and social services and supports. What we have found is that the families do indeed feel very comfortable. We have had one family member basically said to us, this place is an oasis. This is a place where we come to cry, we come to share our concerns, we come to share our joy, and that the birth experience is a powerful experience in order to be able to add that component. The women say, if I can do this, I can do anything. And I can do this not only for my family, I can do this for my community as well. One of the other things that we have learned is that people come and they want to have something like this in their community. And so one of the things that we are trying to do now is to accumulate the resources necessary to replicate this model around the country. That's one of the things that why we were so excited when the AMCHP staff came to do a site visit. They brought about 15 staff members of the organization to see our model, and we began having discussions about how they might be helpful in not only spreading the word, but helping states and jurisdictions think about the creation of this model in some of their most underserved communities. So for us to actually then get the award, the John McQueen Award, yesterday was sort of like a culmination of our interactions with AMCHP, and also kind of a validation of what we're trying to accomplish.